I'm very happy to get the opportunity to interview Dr. John Watson, who's the Deputy Chief Medical Officer for the country of England. We're very happy to have you here in the United States joining us for the BioConvention.
Thank you, it's my pleasure.
And wanted to actually talk to you a little bit about one of the key, most important public health issues that everyone's been talking about, which is the problem of combating antimicrobial resistance. So the UK government has been one of the most active in working on these issues, and I wondered if you could talk a little bit about the problem, both from your country's perspective and globally, and we'll talk about some of the initiatives going on.
Well, funny enough, it was Alexander Fleming, the man who discovered penicillin, who in his Nobel Prize acceptance speech back more than 60 years ago recognized that resistance to antibiotics was going to be a problem. But it's really been only in the last couple of decades that we've begun to realize just how big a problem they are going to be, and how if we don't curb the problem of antimicrobial resistance, then many of the things that we take for granted today, cancer treatment, transplantation, many forms of surgery, will not be possible because we don't have the antibiotic cover to treat the infections that may occur around those procedures. So the impact of antimicrobial resistance is recognized to be a very big issue. It's been recognized in the UK, but of course it's not by any means just a problem for the UK. It's a worldwide problem. And so one of the reasons that the UK has been pushing not only on putting its own house in order, but in taking this issue to an international audience, is because we recognize that we alone, of course, cannot deal with this. All countries need to work together on it.
So to that end, one of the activities that's been going on is global activities with the World Health Organization. And I know that your government and many others really helped at the last World Health Assembly to move along a resolution on antimicrobial resistance. Would you talk a little bit about the resolution?
Well, a lot of this has been led by our Chief Medical Officer, Dame Sally Davis, and she realizes that in order to bring countries together all to the table on this issue, we need to have a common understanding and a common agreement about what needs to be done. And a vehicle to do that is through the World Health Organization. And so we, working with other countries, developed a resolution which was taken to the WHO a year ago, and from that, the agreement on that, has come the development of a global action plan on antimicrobial resistance, which countries around the world have signed up to. And this has just been agreed at the World Health Assembly, and we're delighted that this forms the basis for moving forward around the world, with countries signing up to the actions that they need to take.
Excellent. Well, one of the things we're obviously doing here at Bio is talking about incentivizing industry around many of these global initiatives in public health. And so we're having you talk tomorrow about some of the activities you're doing. We're having Mr. Jim O'Neill speak about an economic analysis in this space. Will you talk a little bit about some of the different roles of industry and some of the work going on to incentivize industry to work on this public health issue?
Well, this is a really important but very tricky issue, because some of the traditional approaches to the way in which the industry, pharmaceutical industry, has operated in the past really cannot work going forward with respect to antibiotics and antimicrobial resistance. And that's because an approach which is based on developing a product and then selling as much of it as possible works against the interest of antimicrobial resistance, because it can lead to the generation of further antimicrobial resistance. And so we need to find ways to be able to incentivize the development of antibiotics and other antimicrobial, anti-infective agents that doesn't encourage the misuse of these drugs and the overuse of these drugs. And so we recognize it to do that we need to work with and to talk with industry to find ways around that and look at the different models that may be possible to encourage the continuing development of these agents whilst ensuring that we preserve them for use for not only ourselves but our children and our children's children.
Absolutely. Well, thank you very much. We're looking forward to your talk tomorrow and to Mr. O'Neill's talk tomorrow as well. Thank you so much for your time.
Thank you.
Thank you.